A very good evening to you. And this is the Community Voices TV with another report. And it's about the Minority Health Disparities Report. And it is about the coronavirus pandemic. First of all, let me say I'm your host, Dr. Aubrey Orrin Lewis, and happy Mother's Day to all the mothers out there. Happy Mother's Day. This is a difficult time to be a parent, especially a mother, having to deal with all of the issues that this pandemic brings. To stay at home personally, the difficult and unhealthy trek to the supermarkets, the loss of job for some people, the loss of income for others, rent is due, your children are at home from school, caring for your elderly parents, being fearful of bringing the virus home to your family because you are forced to work with masks, gloves, and PPE that have been sterilized 30 times, and your inability to get testing and retesting for cure to ensure your own personal health. These are some of the things that mothers across the county of Nassau and across the nation in many districts are dealing with today. And our love, our respect, and appreciation go out to them because they deserve it all. Well, on this Mother's Day, one of the things we need to talk about is that the Governor Cuomo, has decided to send testing facilities to two minority churches in Nassau County. And I will give you the background to that story. As you know, I don't have to tell you that the coronavirus is really devastating our community. And what is sad is the indifference that has been shown to date by the county executive, Ms. Curran, and by the governor, Mr. Cuomo. So on top of all of the issues that parents have to deal with, they also have to deal with the indifference and the racism that is ravaging our community, in addition to the pandemic caused by the virus. So now you're seeing our community, of course, as I said, being deliberately ravaged by the politicians. And this reflects the abject racism here in Nassau County. All right? What has been troubling to date has been the lack of a prevention policy for this pandemic and no attempt at acknowledging the crisis no attempted testing, quarantine, contact tracing, risk evaluation, risk management, or treatment by the governor or the county executive. In other words, this viral pandemic, has released a pandemic of incompetence and racism. Now, the Associated Press just mentioned on May 10th today that 3 members of the White House task force are in quarantine. The 3 members, including Dr. Anthony Fauci, placed themselves in quarantine after coming in contact with someone who tested positive for COVID. Another stark reminder, according to AP, that not even one of the nation's most secure buildings is immune from the virus. After also quarantining are Dr. Robert Redfield, director of the Centers for Disease Control and Prevention, and the Commissioner of Food and Drug, Dr. Stephen Hahn. Fauci's institute said that he has tested negative for COVID and will continue to be tested regularly. Now, I mentioned that because the regular, ordinary folk are still having a great deal of difficulty getting tests done. And if they're tested the first time, they're not being tested a second time for cure. So we have a lot of people walking around with very confused, not knowing if they are positive or not, or if they are free of the virus. This is a distressing, dishonest thing foisted upon New York by the governor. Okay? So now, according to Newsday, Cuomo is sending some facilities to churches, minority and low-income communities near you. This is on May 9th. The state is partnering with, guess who? Northwell, to bring coronavirus testing to 24 churches in minority and low-income communities, including 2 on Long Island, and statistics that show that the COVID-19 crisis is disproportionately impacting Black and Latino communities, Governor Cuomo finally admitted on Saturday. Okay, so let's look at a few of the statistics as we go along. In Suffolk, we have 36,000 confirmed cases. In Nassau, 38,000 confirmed cases. New York City, 183,000 confirmed cases. And statewide, we have 333 confirmed cases. The source, of course, is Nassau and Suffolk County Health Departments, as well as the state. So, the governor, in his daily ad nauseum updates, announced the church-based initiative a day after revealing that 20 of the 21 zip codes with the most people newly hospitalized patients for COVID, including some on Long Island, have larger than average Black and Latino populations, or both. Now, why did it take this good gentleman 3 months to figure out that the virus was indeed attacking and killing Black folks? 3 months. Okay. So he's sending the testing task force, his buddy Mikey Dowling from Northwell, sending them to Union Baptist in Hempstead and the First Baptist Cathedral in Westbury to do the testing. Okay. Now, the pastor of Union Baptist said that the church clearly, for many years, have been the center of the community and therefore its trusted site. So the question one asks is, the church as a trusted site? It is so political that how can it be a trusted site? Trusted for who or whom? That is news to most folks. Churches are anachronistic and have outlived their usefulness. That is another topic for a full discussion. The white politicians have, over the years, they thought that the only place to find black people that are safe is in the confines of the so-called churches. The whites financed and created these mental and spiritual enclosures to babysit and indoctrinate the blacks on Sunday. This was effectively done by employing a spiritual, viral, dependent theology, pandemic created especially for the blacks. This was and is alien to their native African religious traditions. Disinfection of the mind and souls of black people is slowly dying out. It has served its purpose, slavery. But like the Native Americans, who are slowly working their way back to their existential traditions and away from this inquisition that has kept them in spiritual and emotional slavery. So our brothers and sisters that are Native Americans, I'm so proud of them because they are fighting to maintain their native traditions and are doing a pretty good job at it, even though they're, oh boy, they really have their hands full. But they're doing the best they can, and you have to be very proud of them. We should, as black folk, live up to and look up to them for guidance as they go about reclaiming their past. Okay. So the testing is set to open between May 19th and 23rd at the Union Baptist Church, and the First Baptist site is to begin between May 12th and May 16th according to the map the governor displayed. That is the map from his buddy, Dowling, business partner. The new Hyde Park-based Northwell will provide the testing, Cuomo said. Who else will you allow to do the testing, Governor? Someone asked. Quest, LabCorp, Nassau Health Department, Nassau University Medical Center. No, I decreed that it must be my business partners at Northwell. This is big business, you know, goes the dialogue. It was apparently Representative Hakeem Jeferries of the recent fame of the trial of impeachment trial of the president, a Democrat from Brooklyn, who supposedly helped put together the effort. And he said during an appearance in the governor's daily coronavirus briefing that this testing initiative will be incredibly essential in ensuring that we can turn the corner in communities of color. Another poor, clueless politician. By the way, whatever happened to the legislators who represent these affected areas? I hope they did not fall victims to the virus. They've been so silent. Death by racism, incompetence, and indifference is another subtopic. Even though African Americans comprise only 9% of the state's population outside New York City, they account for 18% of the fatalities from the COVID-19. And while Latinos populate outside the city, they represent 14% of the fatalities, according to Cuomo. Notice the governor has not visited any of these black communities in Nassau, hit hard by the pandemic. Notice, too, that the Nassau County executive went to Bethpage to unfold her spectacle about the black experience with COVID. Let's look at some more statistics. Confirmed cases: Suffolk, 36,000. Nassau, 38,000. This is just a repeat of some of the statistics for those of you just checking in. 183,000 confirmed cases in New York City, and statewide, 333 confirmed cases. Total tests in Nassau County, believe it or not, 114,000. Deaths in Hempstead, 2008. In Uniondale, the death toll was 1,059. These are two of the most hardest hit communities. According to the county executive, 22 residents died from COVID-19, bringing the total to 1,940. Suffolk County death toll reached 1,597 after 29 more residents died. New York City now has 14,482 confirmed COVID-19 deaths, along with 5,313 people whose deaths were probably caused by the virus, the city health department reported. So, how do we look at these statistics? Keep in mind that these statistics are not real. They're political, they're made up, and nobody has an idea of what happened, and they don't care. But they'll make some statistics up to look good. So don't take these statistics at heart. We know that the black community is being hard hit by this. We see it ourselves. We don't need statistics to tell us. And what is so tragic is that the victims, our brothers and sisters, are being blamed for their deaths and illness. Because we live in these horrible communities, close and dense, and we do jobs that bring on the virus, so we are to blame for our sickness and death. No wonder. And this is why the governor and the county executive and all these politicians ignore our suffering. Because as far as they're concerned, we brought it on ourselves. Isn't this interesting? However, come election time, they're not so indifferent. So now that Hakeem Jeferries has pointed out to the governor that black people are dying, in fact, not known to the governor, he has instructed the governor, that is, his business partner, Mikey Dowling at Northwell, to put on a spectacle of testing at two of the Democrats' favorite churches, led by their most compliant black pastors. The testing will be a circus designated to make blacks feel that finally something is being done. Nothing could be further from the truth. This governor's behavior shows that he does not care too much about black people. His actions show that black lives do not matter in New York State. What is 2 or 3 days of testing going to show? Nothing. but the obvious. At the rate of testing, they will test approximately 100 residents, if that many, out of 100,000 in that area. So it wouldn't show anything. It's just a spectacle put on to make old Hakeem feel good and to make the pastors of these two churches, beloved by the Democrats, feel good. But at the end of the day, nothing will have been accomplished. Just look at for yourself at the amount of people tested in Nassau County. It runs around 100,000, 150,000 in a population of 1.5 million people. So you know that they're not going to be able to test that many and don't plan to. But they'll make a show of it, and that's going to be it. It's going to be interesting to see if the governor will show up at his two favorite churches. I doubt it, but we'll see. Now, another thing is that, I said, did you notice that the governor, when after Hakeem told him that black people are suffering, a fact that he did not know, he decreed his business partner, Mikey Dowling of Northwell, to do some testing, and not the county health department or the university medical center. Why? Why are these two institutions being left out of this so-called battle? These two institutions are the institutions legally, and I say legally, lightly, because nothing is legal with these guys. They changed the law to suit themselves. But they are constitutionally designed to care for the health and wellness of the people of Nassau County. Why, therefore, is Northwell, being placed in that position? Northwell is a private, for-profit, big profit business partner of the governor. Why, therefore, is Northwell being placed above the Nassau County Health Department and the Nassau University Medical Center? Why? I want the governor to be honest. Don't talk about Trump being dishonest. You get up there, sir, and tell us why Northwell, your business partners, a private for-profit corporation, is being put in charge of the health of New York State, but more in particularly the health of the minorities of Nassau County. Please let us know, since you're the rock star. But in the governor's mind, the health department is useless. And it's a very foregone conclusion that the Nassau University Medical Center is in the way of Northwell and their profit-making scheme. So the game is to pretend that Nassau University Medical Center does not currently exist during this horrible pandemic. And again, they're criticizing the president for his lies and deceitfulness. If you live in a glass house, Mr. Governor, do not throw stones. The governor and his cabal know that the black community is so devoid of strong, independent leadership that the few well-known sycophants who can be paid off with a testing site and their 30 pieces of silver, they will not object to Nassau University Medical Center being closed, even though it will worsen the healthcare access and disparities of their congregants. This is not their issue. If they can be allowed to feel a part of the cabal, this is good enough. What was and still is probably needed are the following if the governor and his cabal are serious. Number one, testing that should have been done from the get-go. Every single resident of Hempstead and Uniondale, where this pandemic exploded into epicenter proportions, should have been tested. This is an abject Harvard Business School failure. When the story of this pandemic is written, these failures will have chapters by themselves. Because for a small community like Uniondale and Hempstead, this was the ideal place to contain the virus on Long Island. You come in, you test everyone, you quarantine those who are sick or have the virus, and then you follow established public health guidelines and virology guidelines after that. So testing should have been done, must be done, and so on. So you could hire unemployed residents to do the testing. Now, I noticed the governor the other day said, oh, well, we don't have money. Well, you have money to give to your friends at Northwell. This is why we pay taxes. It's for health care. It's for health and for everything else. For the police that you have running up and down the street, doing nothing. So don't tell us about you don't have any money. Get some from your friend in Washington. Okay? You could hire so many people who are right now unemployed, and they can be easily taught to do things like contact tracing, testing even. It's no big deal to test anybody. You don't need a medical person to do it. A certified person after a couple of days of training, a day of training will be fine. Okay. Education on physical distancing, masks, and hygienes can be taught. You should work on companies to make masks, gloves, PPE, and ventilators in New York, rather than destroying the health system and giving it to your business partner at North Shore. Proper PPEs and mass disposal. Teach people. These are new behaviors that need to be taught. Hand and body hygiene, scrubbing public places, and transportation. You can hire the TSA agents for that. They are sitting there doing nothing. Nobody is traveling at this time, and they are a bunch of folks that we would like to see them work for a change, and they can be scrubbing public places and transportation. Okay, scrubbing the public streets. I noticed in Korea and Jamaica and Singapore, the streets were being sanitized and washed. None of this has happened in Hempstead or Uniondale. Okay, and I would like the governor to meet with me and let's take a tour and see for himself. Come into the ghetto, come into the hood and see how we live and see how your policies affect us, Mr. Governor. Okay? The governor, Mikey Dowling, and the Nassau County executive should don masks, gloves, and PPEs that have been sterilized at least 30 times and visit the hard-hit black communities, doctors, and nurses as a show of solidarity and compassion. Now we know that ain't gonna happen. So, but it's on the list. You can hire teachers to do one-on-one virtual teaching. You could hire unemployed workers to mentor children and the youth. You could hire mental health workers to address the crisis in mental health that is so obvious before this crisis and is more obvious now. Hire workers to be virtual companions for the elderly. Getting food and other supplies for the elderly and disabled. Establishing access to medical care. Establishment of a minority public health prevention program based at Nassau University Medical Center. Addressing the health divide. Addressing the racial disparities in health and healthcare. Addressing the lack of access to healthcare. Addressing the social determinants of health and healthcare. Addressing the disparities in education. Addressing the disparities in the legal system. Addressing disparities in the economic system. Addressing the disparities in the political system. Now, this one is left up to the black community to release themselves from the sick dependency on the Democrats and become self-sufficient. What will this happen? Not with this current crop of dependent blacks. The hope is with the youth. Finally, the black community must let the governor, Mikey Dowling, and the Nassau County executive know that the Nassau University Medical Center is an important part of the healthcare system serving the black community. The current plan to close it and turn it into a hotel for Northwell will be met with fierce resistance. And I underscore the word fierce. The virus, you haven't seen anything yet. The black community holding both the governor, county executive, and their cabal accountable and responsible for the deaths and illness caused by the viral pandemic due to their incompetence. We will also hold them accountable and responsible for the closure of the Nassau University Medical Center. Let me say this, Mr. Governor, all of these things that I just outlined, all of these disparities happened on your watch or got worse on your watch, and you did absolutely nothing about them. Absolutely nothing. But every day you get up. I don't understand how you can go to sleep. I know you probably would like to serve the people of New York, but you haven't been leaving out large groups. How can you go to sleep not worried or concerned that you're not doing the right thing for black folk and only wanting their support during election campaigns? How could you feel good about that? How could you and your administration feel about that in one of the greatest cities in the world? You have all of these disparities blacks are facing in every aspect of life, and you have no clue. You pretend it doesn't happen. It takes Hakeem Jeferries or the Jumanee Williams to point this out to you. That is shameful. That you have to take two black young men to point to you that all these statistics that you get up there repeating every day reflect the lives and pain and passion of black folk. We just had Easter not too long ago, and the Passion of Christ. I'm sure you're somewhat religious. I'm sure you can relate to the passion. Feel the passion of black folk for a change. Do something about it. Stop that useless daily I want to say a word, but I want to say it here. That daily thing that you do, burnishing your image, and really start working for us. We don't need to know the statistics. They can be published in the newspaper. We don't need you for that. That's a waste of your time. You need to be getting factories together to make our PPE. You need to be spending time, making masks and ventilators and getting the list of things that I outlined done, the racial equalities done, the healthcare dysfunctions done. Stop closing our hospitals. Stop aligning yourself with Northwell as a business partner and putting Northwell in place of the constitutionally designated institutions like the Nassau University Medical Center and the Nassau Health Department. Do something like that. Start if you're really honest, don't talk about Mr. Trump now. Do an antitrust investigation into your buddies, Northwell. How is it hospitals are so difficult to manage, but your business partner has 23 of them and growing? Explain that. Maybe he's a genius. I don't know. 23? Jeez. One is tough enough, 23. And at the same time, while you're enriching your business partner, you are killing the medical center on his behalf so that he can have a clear passage through the South Shore into Suffolk. And the fact that it will impact negatively on minority residents in these communities that are just hit hard with the COVID virus is of no concern to you. Mr. Governor, stop for a moment. Think. 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 The people of this county will hold you and the county executive responsible and accountable for all the deaths and suffering during this pandemic and the closure of their lifeline hospital, the safety net that should be extended at this time. I know you're cutting the Medicaid and you don't care about poor folks, but a safety net hospital you want to close? Shame on you. Shame on you and your friends at Northwell. Putting Northwell in front of the constitutionally designated bodies of the health department and Nassau University Medical Center. This is dictatorial. This is unheard of. And again, quick to point the finger at the president. Now, I'm not saying what he's doing is that hot, but you can't be pointing the finger at somebody who you are emulating stride for stride. You can't do that. So, Mr. Governor, I invite you to come with me, take a tour through my community. See what your wonderful plans are doing, how they're hurting people, killing people. And you can bring Mikey along and Curran and the whole crew. We will set a date aside for you. You could hold a press briefings, finally, in Union there. It's one of the epicenters of the virus. So until then, see ya. Remember, we have to take care of ourselves. We can do better. This governor and this government is not about caring for us. So bye until next time.